Hi, folks. Mayor Kevin Davis. Another installment of the Mayor's Zoom Video Lounge. And I have today with me Jordan Dewar. And Jordan is I have to read this, make sure I get it right, the manager of inpatient surgery and preoperative clinic at our very own Brantford General Hospital. Jordan, thank you very much for agreeing to participate today. And I think we got some great questions that people find very interesting. But first of all, tell us a little bit about yourself and what you do working in the hospital.
I just wanted to say thank you very much for having me here today, Mayor Davis. So graduated from nursing in 2004 and graduated in Thunder Bay, moved to Brantford in 2013, where I had the opportunity to work on our surgical program as a frontline nurse. And 2 years ago, I moved to become the manager of our surgical program here of the inpatient floor and of perioperative services. And currently during this time where we're dealing with COVID-19, I have some additional duties where I'm managing our screening on site, managing our hotline, our assessment center, and just recently have led a team of nurses to go into our long-term care facilities to do some mass swabbing there.
You have a lot of responsibility.
A little bit.
A little bit.
Have a little extra responsibility responding during this time. So we've, our leadership group has done a great job, and our frontline staff as well, of kind of rising to the occasion and kind of all banding together.
Tell me, what's it like to be a frontline worker at the hospital in the fight against COVID-19?
Currently, right now, I don't serve as a frontline worker, but I would say just seeing the frontline workers, I'd say majority of them are going through a mix of emotions at times, from, being proud to serve our community, but also some fear and anxiety during this time as well. A lot of frontline workers have had to make the difficult decision as well of having children and, not maybe struggling to find daycare or usually having their parents watch them. Some have even had to just made that difficult decision of giving their children to their parents, and while they continue to serve our community in the front line. To reduce the risk to their loved ones and to their children. But like I said, overall, we should be, as the frontline workers, I think we should be really proud, and I think they're really proud of of how they've stepped up and risen to the occasion to serve our community during this unique time.
Yeah, I know, certainly. So as mayor, I'm very proud of them and all the frontline workers, no matter what occupation that is. So what measures are in place to ensure the safety of the workers in the hospital and also the patients that come in?
Well, we've done a lot of infection prevention and control and enhanced environmental cleaning. We've done visitor restrictions as well, so just allowing for compassionate visiting. We're temporarily had to cancel the services of our volunteers to protect that population, who we truly miss them, because they are a big part of our team and really do support us. Back to screening on entering the hospital as well for our staff and for our visitors. Also, as well as we're having mandatory masking of our staff and the appropriate use of personal protective equipment, as well as we've had our teams kind of to each area make their unique social distancing plan, so that way they can continue to use their break rooms and still follow appropriate social distancing while on the floor.
Yeah. So Jordan, the screening that's done for employees, so that's done every day, right? As an employee comes into the hospital, what exactly is that screening?
So it's kind of interesting. We've had a lot of support with IT and making quite a unique system where we have computers set up at our front entranceway. So the employee presents with their employee badge. They just basically tap the computer. It populates all our questions that are based on the ministry guidelines, and then they can just tap again if their responses to all those questions are no, and then the screener there proceeds to check the employee's temperature, and if it's at an okay level, then they allow the employee to present to work, or otherwise that employee's not allowed to proceed to work that day.
So let's say that I'm a maintenance worker, and I have to go through the same process, right?
Every single employee, yeah.
Questions is like, have you had a headache or a runny nose, right? I think those are two of the questions. So what happens if I, as an employee, come in and say, yeah, I've got a headache today? What happened?
So then they're directed to our on-site assessment center, where one of our nurses there will do a further investigation on that employee. So they'll ask them a few more questions, because it could just be that the employee has chronic headaches. and we're not going to turn them away just because they, this is a headache they have any day. It's the key to these symptoms is that it's a new onset.
And I take it that's all to make sure that employees don't bring COVID-19 into the hospital. Things that have happened inside the hospital that you'd like the viewer to hear about.
Yeah, so I think just seeing the support from the community and just all the donations that coming in is it's just unbelievable what we're seeing here. Just anything from protective equipment to food donations. It's just the community has really risen up, and you feel the support when you hear. I mean, you see it on your drive home with all the blue ribbons in the community. We've seen, the bangings of pots at 7:30 outside people's front doors. Also, just recently leading a team of nurses out to the long-term care homes to go out there and do mass swabbing of all the residents and staff there. It's truly amazing to see just the appreciation from the staff at those long-term care facilities, and just
Right.
how they've stepped up to really support us there. And we're the ones going in to try and help them, but it's
Right.
just seeing us all band together. It's truly amazing to seeing that, because it's something we don't do on an ordinary day-to-day basis, but maybe something we should do more is just appreciate what each other goes through.
And we've been fortunate in our community that every death we try to avoid that. We've only had 3 so far, and I assume a factor in that has got to be the care that people are receiving, the quality of the care they're receiving at our hospital.
The care that the leaders here have set up, and it's the physician leaders as well that have really stepped up and just kind of they're not doing their normal day-to-day. They're making sure that there's measures put in place to keep our staff and the patients that come to the hospital
Right.
safe, and that they receive the top level care that they deserve and they need during this time.
So do you have any other messages that you'd like to share with the community?
I mean, we all have a role that we play in protecting their community, and just practicing physical distancing and washing our hands, and staying home if we're not feeling well. But also just want to thank everybody for their commitment to the physical
Right.
distancing, and really appreciates everyone's efforts, because it's really helping to flatten the curve as we're really seeing this in our community. But just want to thank everybody for the continued support of one another, and just everybody helping and lending a hand. You really see people stepping up in the community to help each other out. It's not just at the hospital. We see this.
Right.
We do see this in many other occasions where everybody's just kind of stepping up and helping each other out. So it's just we're all in this together, and there are brighter days ahead for sure. So we just need to stay safe.
Yeah, I completely agree with you, Jordan. I mean, our community has really come together very well. I mean, there is an end to this, and we get to that end sooner and with less impact on us the more we each do our part, which for most of us is following those restrictions. And particularly now that we're having the good weather, right? So people like to get outside. We have a bit of a problem with that on the weekend gatherings. And so people can't lose sight of the fact, yes, get out. There's lots of fresh air out there. That's healthy. But please do not gather in groups of more than 5. That's critical.
Absolutely. And you know what? We're doing the same thing here. We're not having, it's a different world for sure, meeting through Zoom meetings
Right.
and Skype meetings. And, we're doing this. We're all doing the same thing. We're all making the same sacrifices.
Okay, Jordan, I want to thank you very much for coming into the Mayor's Zoom interview lounge, and very proud of you and all the other staff at the hospital, and please convey to them my best wishes and that of the Council of the City of Brantford.
All right. Well, thank you very much for having me. Appreciate it.